Hi, everyone. Welcome to MedlinePlus training for the Nubanusit Cooperative Libraries. My name is Margot Malachowski, and my pronouns are she, her. I'm an education and outreach coordinator for the network of the National Library of Medicine in Region 7. Region 7 serves Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. I'm going to share my screen so I can show you my slides. Okay, here we go. Our office at Region 7 is located at UMass Chan Medical School in Worcester, Massachusetts. I will talk more about that in a moment. This session is being taught for the Nubanusit Cooperative Libraries, but it's relevant for a wider audience, which is why I decided to record it and share it out to the New Hampshire library community. Thank you for being here. We are recording on April 24, 2024. The National Library of Medicine is a part of the National Institutes of Health. NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and MedlinePlus. The National Library of Medicine funds 7 medical schools across our nation to coordinate outreach. In the Northeast, outreach is coordinated by UMass Chan Medical School. Our designation is Region 7. On this slide is a map of the United States, and you can see in the Northeast, there's the number 7. We offer training and funding for health-related programs and for technology upgrades. We support equal access to biomedical information so that people can make informed decisions about their own health. In today's session, I will explain Region 7's focused outreach program. I will tell you what we learned about the top health priorities in Cheshire and Sullivan counties in New Hampshire. Then I will pivot to tips on how to handle medical questions that you might get at the library. I will demonstrate how to use MedlinePlus to find quality resources for health and wellness. And I will use the New Hampshire health priorities that we learned about in my sample searches. From 2021 to 2026, Region 7 will conduct outreach to specific rural counties in the Northeast. Our goal is to introduce or to reintroduce the network of the National Library of Medicine as a source of training and funding. Outreach to these counties provides an opportunity for us to learn more about the on-the-ground health priorities and digital access needs of your communities. This valuable insight impacts our future training and funding ideas. Our process is outlined on this slide. It is important to note that focused outreach provides us with a snapshot of community organizations such as libraries and the people that they serve. This information may not reflect the whole focused outreach geographic area, nor everyone within those communities, but it does represent what our interviewees were seeing at the time of our interviews. We conducted 9 interviews in summer 2023 into the fall of 2023. We visited 4 small libraries serving rural communities, a large public library in a small city, a liberal arts college library, a community college library, and a hospital library that serves the veterans in these counties. We interviewed a New Hampshire State Library staff member and the chief executive officer of a substance use recovery program. From these interviews, we learned that the top priorities impacting well-being in Cheshire and Sullivan counties are mental health, accessibility, and I will talk more about that in a moment, technology, environmental concerns, and affordable housing and food insecurity. Interviewees share that addressing substance use disorder is a top health priority for Cheshire and Sullivan counties, and mental health is a related priority. Children's mental health was mentioned in several interviews. Librarians see aggressive behavior among tweens, which is those ages between 10 and 12. Interviewees report that communities need guidance on cyberbullying. We heard concerns about sexual assault on college campuses, the hidden nature of domestic violence, and the specter of gun violence. In addition to community mental health, we heard that library staff are coping with pandemic trauma. Library staff frequently dealt with challenges from the community during the pandemic, whether in the form of resistance to mask mandates, calls for removal of LGBTQIA+ collections, or the prospect of being filmed during a First Amendment audit. Librarians report a greater recognition of neurodiversity in their communities. They want to adjust library services to better meet the needs of neurodiverse patrons. In many towns, more than half the population is 50 years old or older. Librarians note that older patrons frequently experience mobility issues, and not all library buildings are adequately accessible. One interviewee pointed out that people in recovery for opioid use disorder are protected against discrimination under the Americans with Disabilities Act, which is something I didn't know. So this is the slide that addresses that accessibility issue in terms of neurodiversity, older adults, and people who are coping with substance use disorder. With regards to technology and internet connectivity, fewer patrons are using library computers than they did in the past, but they do use the Wi-Fi for their own devices, both inside the library and outside the library, including being in the parking lot in their cars when the library is not open. Interviewees share that some community members are disinterested in technology, observing that some have no use for the internet, even as more services move online. Librarians report that patrons come into the library with an idea of what they want. They do not ask for advice on where to look for information. If patrons do ask for health information, they prefer books. Librarians will gently guide patrons toward reputable internet resources. They assume that patrons and also non-library users Google for health information on their own. One interviewee shared that there are health information resources on the library's website, including EBSCO Health Source and MedlinePlus, but analytics show that these links are not used. Regarding environmental health, air quality is a concern. In the winter, many community members use wood-burning stoves, and air particulates are trapped in the valley. Cheshire and Sullivan counties experienced flash floods last year, and many rural roads were compromised. Some communities cope with PFAS contamination in their water systems. And there's a rising concern about veterans' exposure to environmental toxins during military service, abroad and during service in other parts of the United States. Interviewees comment that access to healthcare is complicated by the lack of public transit in rural communities. Telehealth depends on reliable internet connections and comfort with technology, two additional challenges in rural communities. Healthcare, as well as other industries, is impacted by widespread worker shortages, and this affects the timeliness of patient care. Cheshire and Sullivan counties struggle with lack of affordable housing and food insecurity. During my visits, I saw that libraries host summer meal programs and also women in infant and children nutrition programs, also known as WIC. So that is what we learned in our interviews. We follow up our interviews by consulting publicly available data. These selected resources support our interviewees' observations. We located statistics about the need for child protection services in the Annie E. Casey Kids Count data book. And according to the Robert Wood Johnson Foundation, Cheshire and Sullivan counties are actually improving in their measures for air pollution and particulate matter. We learned that Cheshire Medical Center is working on strategies to develop telehealth capacity, and they are doing community health promotions. They want to build more support for families affected by parental substance use and find ways to address the health concerns of older adults. Monadnock Community Hospital partners with violence prevention programs, as well as substance use support services such as Doorway Keene and Reality Check in Jaffrey. Okay, so we talked about what's happening in Cheshire and Sullivan counties. Let's now pivot to tips on how to handle medical questions that you might get at the library. Now, we hear that patrons rarely ask these types of questions, but how should you handle it if they do? Many library staff are nervous about providing health information. We are not healthcare providers. Yet we can use our information skills to guide patrons toward good resources. I highly recommend MedlinePlus. In a few minutes, we will look at this website. But we know that patrons want more than just the name of a website to search, or obviously a link on the website isn't going to do the trick. They want answers to their healthcare questions. But you can provide information, not necessarily the answers. If a patron approaches the desk or calls on the phone and asks you to read the information to them, I know this happens at some reference desks, stick to reading the written word. Do not attempt to interpret for them. You can feel confident that MedlinePlus contains information that will be accessible to your patrons. There's a lot of actionable patient level information in MedlinePlus. If they push you for interpretations or recommendations, let them know that you can help them find information, but you are not qualified to help them understand the information or to advise them. Always encourage them to contact a healthcare provider. Patron privacy is so important, but sometimes it's the patrons that forget that. They may approach you with a loud voice, or you may answer the phone at a public desk. Do your best to find a private place to answer their questions. And I know this is tricky. When I visited Harrisville Public Library last week, they're a one-room library, so there really is no private place. But some library staff, if it's available, will walk a patron into an office or into the special collections, local history room, or into the stacks even to continue the conversation. And even just lowering your voice may cue the patron to lower their voice and remind them they're in a public place. If you are handling a phone call, you could offer to do some research and call the patron when you're in a more private location. Now, you may be tempted to share your own experiences with a health topic, especially if this is a patron that's a frequent user of your library. This is a really normal urge to establish empathy, but it could backfire. You do not want to establish yourself as any kind of authority on the topic. And finally, remember not to share the patron's information with other staff or patrons. Again, this is a very human response, but we do want to honor the patron's privacy. Now, this was a very quick introduction to health reference. If you want to learn more about ethical and effective strategies for health information reference, I recommend that you register for this free on-demand course offered by the network of the National Library of Medicine. It takes approximately 4 hours to complete. This is one of the many courses that we offer for free. Now, in a minute, I will share my screen to perform some sample searches in MedlinePlus. MedlinePlus is the consumer health information website developed by the National Library of Medicine. I will look for information on knee replacement, on older adult health, and cyberbullying. We will look up the FODMAP diet. I will show you where to locate information on prescription drugs, herbs, and vitamin supplements, as well as medical tests. And every web page in MedlinePlus has an option in the Spanish language. I will show you how to toggle between English and Spanish, which is very useful if you are assisting people who prefer the written, who prefer resources written in Spanish. So pictured here is what MedlinePlus looks like on your computer and what MedlinePlus looks like on your phone. There is not an actual app for MedlinePlus in the App Store, but you can go to medlineplus.gov on your phone and then add it to your home screen. There is no advertising on this website, and MedlinePlus does not endorse any companies or products. MedlinePlus offers information in English and in Spanish in over 1,000 health topics, as well as information on human genetics, medical tests, medications, and dietary supplements. MedlinePlus provides links to languages beyond English and Spanish, but the resources are not as deep. Now let's take a look at the website. I'm going to stop sharing this, and I will go to MedlinePlus. Here we go. Okay, so here is what the MedlinePlus looks like on your computer. There's multiple ways to search MedlinePlus, but my favorite way to search is just to put a topic into this search bar up at the top. So I am going to type in knee replacement here and hit go. Now, if you do a basic search in the search box and it brings you to a set of results. Here, there's 132 results for knee replacement. If it maps to a health topics page, you will see this file folder looking result with an image here. If you do not get this kind of result, and I'll do a sample search where this doesn't happen, you can refine by type to a health topics page here. And the advantage to being on a health topics page is that you get a full description of the health topic and then links to resources. So let me go up to the top of the page here. So here we get the name of the health topic. We also get these also called, if it's called something else. Here it's knee arthroplasty. I would imagine most people would search on knee replacement, but who knows? But in other health topics, you will get this also called set place. And then there is an image on all the health topics pages. Up at the top is a summary of the health topic. And if we keep scrolling down, we will see that there are links to multiple reputable sources that have been selected by librarians at the National Library of Medicine. So here we have a link to information from the Mayo Clinic, from the American Academy of Orthopedic Surgeons, and further, there's links to other resources at the National Institutes of Health, the American Association of Hip and Knee Surgeons. So I appreciate this about MedlinePlus because it allows me to give patrons more than one resource to consult about their health topic. Also, on these health topics pages, on the side, you get recommendations to research your topic in other places within MedlinePlus. And these are all suggestions that really keep you focused on the subject at hand. A lot of commercial websites will have all sorts of other things that you might be interested in on the side. And these could be related to, how what other searches you've done in Google, or, if you've been profiled due to your age or whatever. But in MedlinePlus, when you're doing a search, they're not profiling you. They are keeping you in the topic at hand. So here on the side, I have, here I'll click on hip or knee replacement after questions that you might want to ask your doctor. And even within this, you can see there's additional patient instructions here after how to get your home ready, or, discharge information. Now, of course, many times you get discharge information from your doctor, but I do hear from patients a lot that they feel like they don't get quite enough information. So if you have a patron who comes in who's looking for additional information, MedlinePlus is a great place to go. Okay, so I'm going to do one of these searches that will not take me to a health topics page. I'm going to search on seniors. And I hit go. Okay, so not only did it not bring me to a health topics page, but it did not bring me to anything that has the top results, well, except for this one down here, doesn't call them seniors. And this is because the National Library of Medicine has decided that the preferred term is older adults. Now, I'm hearing a lot that baby boomers don't want to be called seniors. And so you will see that the language has shifted to older adults. So since I do have 820, so MedlinePlus is mapping the word seniors to older adult results. And you will see I have 828 results for seniors. I will refine by type to health topics. And even with health topics, you will see I have 13 results. Now, for the purposes of demonstration, I am going to go down to older adult health, which is the 6th choice. And here I have a health topics page. Oops. And this is the only kind of pop-up you will see in MedlinePlus, by the way. I'm not going to do the survey at this time. So here you get the older adult health. They actually don't do an also called. You have the image up at the top here. And another thing I wanted to point out to you is right here, this is how you can toggle to resources in Spanish. When I click on Espanol, I come to the website. I'm going to click out of this suggestion that I use Google Translate, because this is not Google Translate. This is an actual website in the Spanish language that includes resources for people who would prefer information in Spanish. So all of these side links are in Spanish. All of these resources are in Spanish. They're not identical to the resources necessarily that are in English, but they're all reliably in Spanish, and they are all reputable resources. Let me go back to the English version. Now, I used to work in Springfield, Massachusetts, where many families spoke Spanish in their homes, but I'm not a Spanish speaker or a Spanish reader. And so I would be able to search my health topic in English and then toggle to the Spanish version to identify the things that I could recommend, which was very handy for me. Okay, so here I wanted to point out to you under the medical encyclopedia section that here is what I like to call what to expect when you're aging. And this, in the medical encyclopedia, all of these links will take you to pages to talk about how aging affects our hearing, our body shape, our hair and nails, hormone production, immunity, skin, sleep, bones, muscles, and joints, changes in your face, and on and on. So I was hearing that a lot of patrons coming into libraries are older adults, and this might spark some ideas around doing some health-related programming for older adults to explore the resources in MedlinePlus, just to help them understand what is naturally going to happen as we age. So I just wanted to share that for you. Okay, so again, I'm going to pivot to cyberbullying. We've been talking about older adults. Now let's talk about our younger folks. So when I put cyberbullying in the search box and hit go, again, I did not get one of those health topics pages. I will filter by type or refine by type, and I'll see that the health topics page is actually bullying and cyberbullying put together. So I have a health topics page with an image at the top. Again, I could toggle to Spanish language materials if I'd like. And we get the summary of what is bullying. And down below the summary, there are resources from other sources of information. So we have from the NIH, we also from the Department of Health and Human Services, the Nemours Foundation, which does a lot of resources directly for kids and for parents. We have information about how websites and apps collect and use your information from the Federal Trade Commission, information about sextortion, what kids and caregivers need to know from the Federal Bureau of Investigation, and then more specifics about bullying and LGBTQIA plus youth or with youth with disabilities and special needs, on and on. On this webpage, I wanted to show you that if there is information in languages other than English and Spanish, there will be a section on this health topics page where you could link out to that. And when I click on this, I'll see there's bullying and cyberbullying in multiple languages from Arabic to Vietnamese. Again, it's not going to be every language, and these resources tend to take you to just one resource. Let me click on bullying information for parents in Vietnamese, and what we are getting is a PDF, just one piece of information. Now, I'm going to quickly go to the home page of MedlinePlus because at the bottom of the page, you can look at health information in multiple languages here. Again, let's go to the Arabic here. And this is all of the information that you can get, these bilingual PDFs in Arabic. And as you can see, there's multiple health topics, but this is as deep as it goes, is these PDFs. Now, this can be very useful for, always take a look if you are serving a community that would prefer resources in other languages. And if you do, again, when I worked in Springfield, I did a health fair for a community that had a lot of Vietnamese immigrants. And so I just printed everything out that was there so that I could have something on my table that might be helpful to them. I am going to return to this cyberbullying page. Excuse me. Bullying and cyberbullying. Oops. Clicked too fast. There we go. Because here on the related topics, again, the National Library of Medicine wants to really help you research this particular health topic. You will see that there are related health topics on child mental health, school health, teen mental health, and teen violence. If I click on the child mental health page, you'll see that I have a health topics page on child mental health. And the medical encyclopedia has links to children in grief or generalized anxiety disorder, etc. And here I want to show you the child behavior disorders health topics page. So here we get the also called conduct disorders. We have the summary, and below we have resources from the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry. And here we could learn, and this might be useful for your patrons or your staff, what is normal child behavior, when to seek help for your child. Is this just a stage? What's it like to bring a child to the therapist? What's the who's who in mental health? What's the difference between a social worker and a therapist and a psychiatrist and a psychologist? What are some different psychotherapies for children and adolescents? So here is a very rich resource that's taking you to multiple reputable sources of information about child behavior disorders. Okay, I'm going to shift again. I was hearing from librarians that they get questions about different diets and cookbooks for different diets. And so here is one about FODMAP. So FODMAP is a diet for people who have irritable bowel syndrome. It's to kind of help people who are having a lot of tummy distress. So I did put in FODMAP. I did not get one of those health topics pages. And what I wanted to show you here is it said, did you mean roadmap? Now, of course, I did not mean roadmap in this case, but if you do misspell something or, it will give you one of those, did you mean results. I'm going to stick with, I already had looked at the health topics page, and this is a whole health topics page on irritable bowel syndrome. So I'm going to stick with this top list, which is part of the medical encyclopedia. You can see up here on this trail here that it's the homepage, the medical encyclopedia and the low FODMAP diet. So here it tells you an explanation of what FODMAP stands for, how to follow the diet, what to avoid, what's okay, etc. Now here is where I want to pause and talk a little bit about what you can collect in your book collections that are useful for your patrons. Really, for diagnosis and treatment, MedlinePlus is really the place to go. I know that people come in looking for books, but in terms of diagnosis and treatment, the most up-to-date information is online. And so being able to go to a resource like MedlinePlus that is linking you out to reputable sources of information is really the best way to go. And anything on your shelf that's older than 5 years, that's diagnosis and treatment, it really should be tossed. Sorry to say. But books for support, such as cookbooks for low FODMAP diets or gluten-free diets or heart-healthy diets, those are all great things to have on your shelves. Also, other kinds of emotional support or support in the form of mindfulness practices, those sorts of things can stay on your shelf a little longer because it's not changing as rapidly as diagnosis and treatment. We do have a course, another on-demand course on managing your book collections that I recommend. And so check that out. It's another course that you can log in at your own convenience and go at your own pace and really get a great idea of best practices for managing book collections. All right, I'm going to go back to the home page of MedlinePlus, and you will see up at the top here, I could search health topics this way, but what it's bringing me is an A to Z list. This may be useful for the most part. I think the best way to search a health topic is to do as I've been doing and put a term into or a phrase into the search box. But you can search the health topics this way as well. There's also information on drugs and supplements. You can browse drugs, both prescription drugs and over-the-counter drugs, by generic or brand name on, in this A to Z list. This I think is more manageable in an A to Z list. Let's go with A. Let's go, and I believe for demonstration purposes, I did acetaminophen and codeine. And this information is what you get when you get your prescription medication and you get that little piece of paper folded up really small, and the font is really small. So this is just easier to read, but it's basically the same information and how why it was prescribed, how it should be used, and if there's any special precautions. And if there is a warning, it will appear right up at the top here. Let me go back to the herbs and supplements. Below the prescription and over-the-counter medications, you'll get a link to all herbs and supplements. And here I popped down to V for valerian. So you will see that the resources are taking you out to a couple of different places. The valerian example that I'll show you here is taking us to the National Center for Complementary and Integrative Health. This is one of the institutes at the NIH. They are doing research on all sorts of topics, from acupuncture to mindfulness to Tai Chi, and also things like herbs. They will give you the background of the herb and what do we know. Now, I will say that sometimes this is frustrating for folks, that there hasn't been enough research on herbs that people might like to use in addition to or instead of medication. So I know this can be frustrating, but what I really recommend is for people to understand if there is any safety information. So here, the research suggests that valerian is generally safe for short-term use by most adults. It has been used in apparent safety for studies lasting up to 28 days. But it's unknown about using it in pregnancy or while breastfeeding, etc. So that's important information. You also, now the vitamin B6 link is taking us to, it's keeping us within MedlinePlus and giving us a similar sort of resource page as the medications, the prescription medications. What is it? How effective is it? Again, is it safe? And I always encourage people to check out the interactions with other medications and interactions with herbs and supplements, also interactions with foods. Let me go back to that page. The third place that you might be taken to, if you are in the herbs and supplements section, is the National Institutes of Health Office for Dietary Supplements. And this is a fact sheet on vitamin D. Again, what does it do? How much vitamin D do I need? Where can I get it in foods? And can vitamin D be harmful? Can it interact with medications or other dietary supplements, etc.? So again, I just want to reiterate that when you are talking about herbs and supplements, to really check the safety information. There's also information on human genetics, which I won't go into today. We've been looking at a lot of the resources that are linked within those health topics pages that take us to the medical encyclopedia. All of that information on what to expect when you're aging is in the medical encyclopedia part, as well as the FODMAP diet. But here is where you can look up medical tests. And here, I believe I was looking at, again, you get an A to Z list. And I looked at information on an allergy skin test. You get an explanation of what that test is, what's it used for, and what happens during that test. And then there's, again, related health topics if you want to learn more about allergy, anaphylaxis, drug interactions, and related medical tests. Okay, so I really hope you will consider using MedlinePlus both in your work and in your personal life. So let me stop sharing that. I am going to look again at my slides because I have a last slide that I want to finish up with. Okay, share with this here. There. Oops. No, it wants me to take you through the whole thing. Bear with me. These are the slides I used when I was in Harrisville. Okay, here we go. Okay, so there's other ways we can support you by, when we offer the trainings that I've talked about. Region 7 also has graphic medicine kits. And graphic medicine is the use of graphic novels and memoirs to explore health topics. And so Region 7 has a program where we will send you a collection of books and a discussion guide. We send them for free and we include the postage for you to send them back. And so it's a really great and engaging way to talk about a variety of health concerns. And I will when I send this information out to the listserv, I will include links to information about the graphic medicine kits. Also, the network of the National Library of Medicine has reading club ideas. In this case, we don't send you the books, but every month there's a selection of 3 books that could be used in a reading club, as well as supports for discussion. And the books are selected in terms of aligning with whatever month it is, a health awareness month. So for April, it was an awareness month on neurodiversity. And I do recommend, and again, I will send you the link to that when I send the link out to the YouTube recording. And again, I suggest you take a look at both of these resources, even for collection ideas. And last, I highly recommend that you sign up for our Region 7 newsletter. We send out a weekly newsletter about upcoming trainings and funding opportunities. It's really the best way to keep in touch with us. And if you join, if your organization joins as a member, which is another thing I encourage you to do, then you will be automatically subscribed to the newsletter. But you can, as an individual, also subscribe to the newsletter. All right, so I'm going to stop my share and thank you very much for joining me. And I hope this was useful to you. Thanks.